Do we think there's also behavioral differences based on sex and gender, race and ethnicity? There was some data early on that talked about men aren't as good hand washers. They don't wear the masks consistently. How much behavior based on sex and gender do you think is playing into these differences in terms of transmission and ultimate cases and mortality? I'd like both of you to reply to that.
Well, you're right, John. It's been documented that women tend to have better hygiene than do men. So
I said hand washing.
hand washing is critical, wearing masks. But men are risk takers. They tend to be the type of people that would be the last to wear a mask as opposed to women. We tend to, as women, do sort of the typical, let's protect the family in every possible way. And we really gravitate quickly to that response. And so hand washing, distancing, all of those things, we tend to see more often in women than in men.
So I often say, John, that we have masculine and feminine type behaviors, right? That these are behaviors, therefore they're gendered. Gender is a spectrum. Masculine behavior does tend to be those risk takers. They tend to be the ones that throughout society and thousands of years of evolution tend to be the more invincible ones. You are out there, foraging, protecting the family. And I think that does lend itself to the 21st century behaviors that we're seeing. Men are much less likely to also physical distance. So we do know that those behaviors are more likely to increase the risk of contracting the novel coronavirus.